Thank you for being here to hear a little bit more about our research examining depression, self criticism, and non suicidal self injury in young adults. First, it's important to know that prior research has shown both cross sectional and longitudinal relationships between depression, self criticism, and non suicidal self injury. However, typically these variables have not been considered concurrently to identify whether one or another is a stronger predictor of non suicidal self injury. The relationships between depression and self criticism with NSSI are consistent with functional literature, which shows that non suicidal self injury often occurs as a way to downregulate intense negative emotions or to punish oneself for perceived mistakes or errors. Non suicidal self injury has been shown to be a strong risk factor for suicidal thoughts and behaviors. And thus, individuals who engage in non suicidal self injury may be considered a high risk group for targeting suicide prevention efforts. We also know that among those with a history of NSSI, individuals who report more extensive engagement in NSSI are at greater risk. And this suggests that it's important to identify treatment targets to prevent further NSSI among individuals who are struggling. To address some of the gaps in the literature, our goal with this project was to examine depression and self criticism concurrently as potential prospective NSSI risk factors. Our first question considered whether depression and self criticism could predict any occurrence of non suicidal self injury urges over a 6-week follow up period. So, essentially determining whether these could tell us which individuals are most likely to experience NSSI urges outcomes. Our second question considered within person changes. We were specifically interested in whether follow up assessments of depression and self criticism were concurrently related to reported NSSI urges at the same time point, or whether those experiences would prospectively predict changes in NSSI urges over time for these at risk individuals. These data were drawn from a larger study looking at help seeking behaviors among depressed individuals. And so participants were college students recruited on the basis of elevated depressive symptoms. Importantly, participants were recruited using both internet and flyer advertisements across the entire Texas Tech campus, and participants were paid for their participation rather than recruited through a psychology subject pool. So we expect these results are likely more representative of the Texas Tech student body as a whole. Participants first came to complete a baseline intake session where they completed a battery of self-report questionnaires. And then 2, 4, and 6 weeks after they completed their baseline session, participants were sent a survey to their primary email address to complete with respect to their experiences over that preceding 2-week interval. For these analyses, we focused on the 92 individuals who reported a history of NSSI at baseline and who completed at least one follow-up assessment. Participants completed the inventory of statements about self-injury at baseline to assess both whether they should be included in these analyses as well as indicators of NSSI severity. Depression was measured using the PHQ-9, a well-validated and commonly used measure to assess recent depressive symptoms. The self-criticism subscale of the Depressive Experiences Questionnaire was used to assess self-critical beliefs and thoughts. And at the follow-up assessments, participants were asked to rate on a 1 to 7 Likert type scale how frequently they experienced NSSI urges over the preceding 2 weeks. For our first question, we used binary logistic regression to predict whether an individual had experienced any NSSI urges over follow-up, which was the case for about 60% of the sample. Our predictors were depression and self-criticism, and age and race ethnicity were included as covariates since those were related to NSSI urges over follow-up. Question 2 was tested using a cross-liked panel model where NSSI urges, depression, and self-criticism were all allowed to covary within the same time point and to predict themselves and each other over time using lagged effects. Following preliminary investigation, we found that it was best to allow parameter estimates to be fixed to equality across each of the 3 follow-up windows. And we used maximum likelihood modeling and Monte Carlo integration to account for missing data. The sample was on average about 20 years old and primarily comprised of cisgender women. With respect to race ethnicity, participants had similar demographics to the Texas Tech student body, about half non-Hispanic white and about a quarter Hispanic or Latinx, with the remaining quarter comprising people of other racial and ethnic backgrounds. The average participant reported over 4 methods of NSSI and over 90 episodes of NSSI in their lifetime. Number of episodes was highly skewed, and so that variable was rank transformed for analyses. With respect to recency, about a third of participants had engaged in NSSI in the month before they enrolled in the study. And in addition to NSSI urges being assessed over follow-up, about 13% of the sample reported NSSI behaviors over follow-up. So for our first question, again, we use binary logistic regression. For ease of display, I'm only going to display the parameter estimates for our specific predictors of interest, not the constants or covariates. And in all cases, the models themselves were statistically significant. First, we examined a model with depression as the only predictor of NSSI urges over follow-up, again, excluding covariates. And the overall effect was significant. So what you see here is an odds ratio followed by the 95% confidence interval around that odds ratio. If a 95% confidence interval does not include the value 1, that means that it was statistically significant at p less than 0.05. And for interpretation, what this means is that every 1 point increase in PHQ-9 score resulted in a 1.14 times increased odds of an individual reporting NSSI urges over follow-up. When we examine self-criticism as a singular predictor, we again found statistically significant and in this case quite large effects, where a 1 point increase in self-criticism resulted in a 2.32 times increased odds of reporting NSSI urges over follow-up. Finally, we examined a combined model with both depression and self-criticism as predictors. In this case, self-criticism continued to maintain a statistically significant and large effect on NSSI urges over follow-up, whereas depressive symptoms were no longer statistically significant in the combined model. And this pattern continued to hold even when we included measures of NSSI severity as covariates. We considered NSSI frequency, NSSI number of methods, and NSSI recency as potential covariates here. Our second question, again, we addressed with a cross-legged panel model. This is a simplified representation representing the associations over a particular follow-up interval. What you see on the far left are the covariances between the variables at the same time point with the double-headed arrows. And then the single-headed arrows in the middle of the screen show lagged effects, either autoregressive effects of the same parameter on itself or cross-lagged effects, one parameter affecting another parameter. And what this means is if there is a statistically significant effect that is above and beyond the stability of the particular parameter that's being predicted over time. So these were all of the parameters that we modeled. However, many of them were not statistically significant, so I'll remove those now. And these show you the unstandardized estimates for each of these statistically significant parameters. Essentially, each of the horizontal lines shows significant autoregressive effect, meaning that these scores were to some extent stable over time, or they were correlated with each other over time within the individual. You'll also notice that self-criticism at one time point predicts elevated NSSI urges at the next time point. And this is accounting for within-person stability of NSSI urges over time. On the far left, you can see that at the same time point, depression and self-criticism were strongly positively related. Depression and NSSI urges were positively related. However, NSSI urges and self-criticism were negatively correlated with each other. This may be a suppression effect, given how strongly depression and self-criticism were related to each other, or it may be that NSSI urges that do not lead to NSSI behaviors may lead to decreased perceptions of self-criticism over that same interval. So our overall results suggest that self-criticism may be an important target for interventions supporting people who are struggling with NSSI urges. However, more real-time work is needed to understand how self-criticism may change following NSSI urges or behaviors over the course of minutes, hours, or days. And importantly, our results require replication both in other age groups and in more racially diverse samples. I'd like to thank my collaborators, the undergraduate and graduate research assistants who ran the study and without whom this would have been impossible, as well as our participants for providing this valuable data. I'm happy to answer questions now or to answer questions via email at any other time. Thank you.